Yo, bro, how's your English IC going?
Yo, man, I haven't started yet.
Yeah, sucks, bro. I haven't started my ISU either.
Yo, man, how's bio going for you?
Bro, Steinica is piling on the quizzes.
Yeah, man, that's really good.
Bro, are you like drunk?
Yeah.
Bro, are you okay? Hey, bro, are you okay? Whoa, bro. It's okay, sit down. Whoa. Calm down, buddy. Oh my gosh, Josh. I'm just gonna check your pulse, okay? Oh my gosh, okay. Stay calm. Good thing I took bio. Okay, this is bad. I'm gonna call 911. Hello? 911? There's an emergency.
Hey, how can I help you?
Hi there, I have an appointment with Dr. Mad Dog.
Hey, can I have your healthcare, please?
Yeah, sure, no problem. Here you go.
Thank you. Josh Paul? Shall I see, okay?
Thank you. Yo, did you know that 1 in 5 parents don't take their kids to the doctor every year?
Oh, pretty interesting.
Yeah.
Hey, bro, check this out. Clever Girl Mascaras, 50% off. Only this week.
So, what seems to be the issue?
Well, doctor, recently I had a stroke, and I just wanted to get a better understanding of what happened that day.
A stroke is a sudden loss of brain function caused by clotting in the vessels of the brain or heart, which restricts blood flow. Also, there are 2 different types of strokes, hemorrhagic and ischemic. Ischemic is a rupture in the vessels of the brain and causes cells to die in the affected area. Hemorrhagic is a loss of blood from a vessel in the brain. Most patients tend to have hemorrhagic strokes. Lucky for you, you didn't have a serious ischemic stroke.
Go.
Okay, so could you please explain the symptoms, please?
Well, the symptoms he had was just weakness on his arm. He had some numbness in his face. I remember he had trouble speaking. He had headache, and when he got up, he was very dizzy, and he could not stand up properly.
Alright, so do you have any history of TIA?
Doctor, what's TIA?
Okay, so basically, TIA is a transient episode of neurologic dysfunction caused by ischemia, loss of blood flow, either focal brain, spinal cord, or retinal, without acute infarction, or frequently referred as the mini strokes, and they have really relative symptoms to the stroke that you had.
Really? I didn't know that.
Do you have any current history of high blood pressure or high cholesterol, perhaps?
Yeah, I have high cholesterol.
So do you take on any stress during the day?
Yeah, we're living tough times, doc. You know, with the recession, all my stocks are dropping, my wife doesn't love me anymore. I do take on a lot of stress.
Do you smoke?
Yes.
Alright, I'm just gonna check your blood pressure now, okay?
Alright.
Get this on.
Yeah.
This one? Yep. Release. Yep. Alright. It's pretty high.
Really? Oh my.
Okay, so there are many tests and examinations that you could do for this stroke. So basically there's a physical examination that we just did with the stethoscope. I'll check your blood pressure and your breathing rates, and we discuss the symptoms so I know what type of severity it is. And there are blood tests as well, and this is when I take a sample of your blood, send it to the CML, and they can tell me the difference between an ideal blood and your blood, so like chemical balances and like abnormality in your sugar.
In bio class, we learned about thrombolytic drugs such as TPA, which are often called clot busters. TPA is a drug that can stop a stroke caused by blood clot by breaking up the clot. Is that true?
Yeah, that's correct. You have a really clever bio teacher. Okay, first of all, if you ever have a stroke again, call 911 or your local emergency number. And then there can be many treatments that you receive, and will depend on the severity of the stroke, like I said before, and how serious the stroke was, and also your age and your health and your health history. So some treatments could be the TPA, which he explained very well, and there is a surgery that can be done. In some cases, surgery may be required to repair damage or stroke, or to prevent stroke from occurring again. Surgery may be performed to remove blood that has pooled in the brain after a hemorrhagic stroke, to repair broken blood vessels, or to remove plaque from inside the carotid artery. Also, catheter-based procedures are being developed to remove plaque buildup from arteries and to treat aneurysms.
Really? I didn't know that.
And also there is a computerized tomography, it's CT scan. It's brain imaging basically, and it tells me what type of stroke you experienced. And this scan creates a detailed image of your brain. And a CT scan shows a brain hemorrhage, tumors, strokes, and other conditions. And like doctors like me can inject dye into your blood to see the vessels. And along with this, there is a magnetic resonance imaging, MRI.
What's an MRI?
Right. So MRI uses powerful radio waves and magnets to create detailed views of your brain as well, but it's more accurate, I think. And MRI can detect brain tissues and damages in the ischemic stroke and brain hemorrhages. So that's that. And there's a carotid ultrasound. It's basically images of the inside of the carotid arteries in your neck. And depending on the arteries and the size of it, I can tell the pressure in which caused the stroke. And there are cerebral angiograms. And this is when I insert a thin, flexible tube, it's gonna hurt, through a small incision, usually your groin, and it guides it through your major arteries and into your carotid and vertebral arteries. And lastly, there's an echocardiogram. This uses sound waves to create detailed images of your heart. So when the spikes show me how severe your stroke was, and it finds sources such as clots in your heart that may have traveled in your arteries and caused a stroke as well. And so yeah, that's basically it.
Thanks, Doc. You taught me a lot today. You have a good day. Another beautiful day.
Yeah, I agree.
It's a good thing I got those 3 prescriptions from that doc. Thanks, man. You were there for me when I needed it.
No problem. That's what good friends are for.
So have you started on that bio yet?